Lauren Driscoll, who's joining me today from NourishedRx, a really wonderful organization that's providing highly personalized food solutions for both health plan and providers to the most vulnerable members of the community. But I'd love to welcome you, Lauren, to the program, and would love to get you to introduce yourself for a quick 60 seconds to let everybody know that's in the audience about yourself and what you do at NourishedRx.
Perfect. Thank you so much, Jerry, and Stan, thank you for having me today. So my name is Lauren Driscoll, and I'm the founder and CEO of NourishedRx. And my background is really across a number of different healthcare settings. I've worked in policy settings, I've worked in managed care. I ran the Medicare business for Oxford Health Plans before it was bought by United. And then after the Affordable Care Act passed, I worked with Governor Mike Leavitt, who'd been Secretary of Health and Human Services at Leavitt Partners. And after he left DC, he started Leavitt Partners to really help private sector companies navigate the Affordable Care Act and, in particular, value-based care. But the common thread throughout all of that experience is, and across those different settings, has really been a focus on vulnerable populations. And I come at that both from a values standpoint, and that clearly, you want to support the people who need it the most, and also from really a healthcare reform standpoint, really wanting to drive better outcomes, more equity, and more efficiently at a lower cost. And I've just, as a result of a focus there, I've had a long time focus on the social drivers of health, and in particular, just in the importance of nutrition and food access. And I've had, long held conviction that we as a country have really nutrition and food access has just been a glaring missed opportunity when it comes to healthcare delivery. So took the plunge in 2019, actually with the support of the Health Policy and Management Department at Mailman, and started NourishedRx.
No, that's really wonderful, and I think it's a really great time to be able to making that kind to make that kind of impact in the communities today. But I'd like to take it back to sort of the really sort of basic concept of food as medicine, which I think everybody on the call today can really relate to, and how that's evolved over time, and the factors that have influenced the trajectory in modern healthcare practices.
Yeah, for sure. So I would say when I was first setting out to start NourishedRx, I assessed the landscape with respect to nutrition and food access. And to be honest, food as medicine wasn't even a common term at that point in 2019. And what I saw was really a number of different point solutions. I mean, you had medically tailored meals, certainly some produce prescriptions, definitely amazing work being done by food banks, food assistants, but really they were all pretty siloed, and at least on the medically tailored meals side, very, very much fee for service. And I think what's happened just over the last 4 to 5 years is, obviously COVID shined a bright light on health disparities, and
Mhm.
nutrition is such a root cause of health disparities. I think COVID also, really brought about much more home delivery of prepared meals and meal kits. And so there was just more agility really in the food system to actually get food to people and have them select what they're eating at home. But I think really with the progression of value-based care, in addition, what we have recognized as a company is that as opposed to delivering point solutions that are sort of food as medicine related in silos, if you're addressing really the people who need the help the most and are costing our system the most, it's important to have a broad tool belt to be able to provide a comprehensive solution. So across all of those point solutions. So I think increasingly you're seeing more of a value-based care approach where, we're delivering really a bundle of nutrition and food access related services in a personalized way to really be able to optimize outcomes.
Yeah, no, absolutely, absolutely. Yeah, and I think COVID definitely did change the face of how we see sort of nutrition with all of these different sort of services, as you mentioned, sort of coming into into the communities, and none less so, of course, than what you're doing right now with NourishedRx. And I think we'd love to hear a little bit more about the approach that you guys are taking to integrating food as medicine into the healthcare model, and how does it sort of differ from sort of the more traditional approaches?
Right. So we really don't think of ourselves as a food delivery company. We very much are a healthcare company, and our leadership team is, all steeped in healthcare. And so as such, it's very important to us to be clinically integrated and really an extension of care and disease management programs. And also to really systematically measure as we work with members longitudinally. But really, to take a step back, we consider ourselves very much an integrator. So we we have a modern and configurable technology stack that enables us to integrate with an array of point solutions. So prepared meals, produce and groceries, even fintech solutions addressing food access, telenutrition counseling, an app, healthy eating app, obesity telehealth, even community-based resources. So we're that really technology backbone that's integrating all of those different point solutions. And then on top of that, because we really are targeting folks who are nutrition insecure, who also have diet-related disease like heart failure, diabetes, kidney disease. We also do maternal health. There are additional resources or capabilities beyond those that we integrate with that we have really built on top of our platform. And so part of that is integrating a very diverse food network so that we can be genuinely culturally responsive and really meet people where they are with respect to their taste preferences. A very broad array of educational resources that are available through an omni-channel experience. So, if people don't have access to technology or a degree of comfort with technology, we can connect through simple text, email, app, but also telephonically. And then also the ability to connect people to community-based resources so that they're able to, continue to navigate their own food landscape optimally. And then I guess the last thing I would say is we were built on a FHIR-based platform so that we can be fully interoperable with our healthcare payer partners and provider partners.
No, that's really, really wonderful, Lauren. Thanks so much for giving us such a really detailed overview about the brilliant work that you guys are doing. I'm so sorry we don't have more time to cover all the other points you really wanted to make, but we did put your details into the chat so people can connect with you that are really interested about the work that you're doing. And I'd like to thank you so much for coming on the program, albeit for a very short conversation. But hopefully you can continue talking about the great work that you're doing and the communities that you are serving via NourishedRx with the audience here today.
Great. Thank you so much. Really appreciate it.
Thanks so much,
Take
Lauren.
care. Bye-bye.